Have you ever been given a blood test full of numbers, asterisks, and difficult words, and no one really explained what they mean? Today I want you to stay until the end because you are going to learn how to read a basic blood test, which values to look at first, which ones you should never ignore, and how to detect early warning signs before symptoms appear. I'm Dr. Sinclair, and this space exists to help you understand your body and take care of your health with clear information. What a blood test really is. A blood test is not a definitive diagnosis. It is an internal snapshot of how your body is functioning at that moment. It is a biological map that reflects the state of your organs, your metabolism, your immune system, and your level of inflammation, even when you feel apparently well. Blood carries oxygen, nutrients, hormones, immune defenses, and chemical signals. When something begins to lose balance, even mildly, the blood often shows it long before pain, extreme fatigue, or visible disease appear. After the age of 50 or 60, the body changes. Systems become more sensitive, margins for error become smaller, and blood tests turn into a key tool for prevention. They are not only useful for detecting disease, but also for anticipating problems, adjusting habits, and avoiding future complications. The most common mistake when reading results. The most frequent mistake is looking at the test only to see whether it says normal or out of range, without understanding what each value actually represents. Another very common mistake is thinking, if the doctor didn't say anything, then everything must be fine. In reality, many values are technically within range, but get worse year after year. And that progressive trend is an important warning sign. It is also a mistake to look at a single isolated test. Health is understood over time. Comparing current results with previous ones allows you to detect silent changes that, if corrected early, can prevent major problems. Understanding your results is not about distrusting your doctor. It is about actively participating in your own health. How to read a blood test, step by step. A basic blood test usually includes several sections. You don't need to understand everything at once, but you do need to know what to look at first and which questions to ask. Complete blood count. The general state of your blood. The complete blood count is one of the most important and at the same time most underestimated tests. Red blood cells and hemoglobin show how oxygen is transported to your tissues. When these values are low, the body receives less oxygen and symptoms appear, such as persistent fatigue, weakness, shortness of breath when walking, dizziness, or palpitations. Many older adults normalize these symptoms, thinking they are just part of aging, when in reality, they may be signs of anemia or nutritional deficiencies. White blood cells reflect how the immune system is functioning. High values may indicate infection, chronic inflammation, or prolonged stress. Very low values may signal weakened defenses, something especially relevant in older adults. Platelets play a role in blood clotting. Abnormal levels can increase the risk of bleeding, or, on the opposite end, the risk of clots. The complete blood count does not hurt, does not warn, but it says a lot about overall health. Blood glucose, the silent warning. Blood glucose reflects how the body uses and regulates sugar from food. It is not just a number related to diabetes. It is a central indicator of overall metabolic health. When glucose remains elevated over time, even slightly above ideal levels, damage begins long before a formal diagnosis is made. Excess glucose circulating in the blood acts as a constant irritant to blood vessels. Over time, it hardens and weakens arteries, affects nerve sensitivity, overloads the kidneys, damages vision, and accelerates brain aging. That is why many complications appear even in people who are not diabetic but have had borderline values poorly controlled for years. Diabetes does not appear overnight. It is the result of a slow, silent, cumulative process. First comes insulin resistance, then post-meal sugar spikes, and later persistent elevation in fasting glucose. At this early stage, most people feel no pain and no clear symptoms, but the blood is already showing that something is not working properly. After age 60, glucose control becomes even more important. Metabolism becomes less efficient, muscle mass decreases, and the body tolerates excesses poorly. Even without a diabetes diagnosis, keeping stable glucose levels protects the heart, the brain, and the kidneys. Controlling glucose is not only about preventing diabetes, it is about preserving quality of life and independence. Cholesterol. Understanding more than just the total. Cholesterol should not be interpreted as a single isolated number. So-called total cholesterol is only a sum that can hide important imbalances. To assess real risk, it is essential to analyze each fraction separately and understand how they interact. LDL, known as bad cholesterol, is the one that deposits in artery walls when elevated. Over time, it promotes plaque formation that narrows blood vessels and restricts blood flow, increasing the risk of heart attack and stroke. It's not just how high LDL is, but how long it has been elevated. HDL, the good cholesterol, has a protective role. It helps remove excess cholesterol from arteries and transport it back to the liver for elimination. Low HDL levels reduce this natural protection, even when total cholesterol looks acceptable. Triglycerides reflect how the body handles excess sugars and fats. When elevated, they often indicate altered metabolism, excessive intake of refined carbohydrates, sugars, or alcohol, and increased cardiovascular risk. High triglycerides are often accompanied by low HDL, a particularly unfavorable combination. That is why a normal total cholesterol does not always mean low risk. It may hide high LDL, high triglycerides, or insufficient HDL. Looking at the full lipid profile and comparing it with previous tests allows dangerous trends to be detected before symptoms appear. In cardiovascular health, what accumulates silently is often the most dangerous. Kidney function. The kidneys also speak. Kidney function is mainly evaluated through creatinine, urea, and in many tests, estimated glomerular filtration rate. These values show how well the kidneys are filtering the blood and removing waste. The kidneys work non-stop, 24 hours a day. But unlike other organs, they do not cause pain or clear symptoms when they begin to fail. For this reason, many older adults have mild or moderate kidney impairment without knowing it. The problem usually does not appear suddenly. It develops slowly and silently. Creatinine may rise only slightly, urea may remain at the upper limit, and the body continues to function normally. But internally, filtering capacity is already reduced. After age 60, the kidneys become especially sensitive to certain factors. Frequent use of anti-inflammatory drugs such as diclofenac, ibuprofen, or naproxen is one of the most common causes of progressive kidney damage. Added to this are chronic dehydration, very common in people who drink little water for fear of nighttime urination or lack of thirst, and poorly controlled blood pressure, which directly damages the small vessels of the kidney. That is why the kidneys speak through blood tests long before the body complains. Liver, the organ that works in silence. The liver is one of the strongest and hardest working organs in the body, and also one of the quietest. Liver enzymes such as AST, ALT, GGT, and alkaline phosphatase indicate how the liver is responding to its daily workload. These enzymes can be mildly but persistently elevated without causing any noticeable symptoms. The liver processes medications, alcohol, fats, sugars, and toxins. In older adults, this load is often constant. Chronic treatments, occasional self-medication, social alcohol consumption, and a diet that may not be ideal. All of this can overload the liver without pain, marked fatigue, or obvious discomfort. Mild but sustained enzyme elevations may be an early sign of fatty liver, even in people who do not drink alcohol. They may also indicate excessive medication use, drug interactions, or chronic low-grade inflammation. The problem is not a single spike, but values that remain altered over time. Checking liver function is especially important for people who take daily medications, such as painkillers, anti-inflammatories, statins, anti-anxiety drugs, or blood pressure treatments. An overloaded liver processes drugs less efficiently, increasing side effects and reducing treatment effectiveness. Blood tests allow these signs to be detected early. Adjusting medication, improving diet, reducing alcohol, and reviewing interactions can relieve the liver before complications appear. The liver does not complain, but when it is listened to in time, it responds very well to change. When a result should catch your attention, there are warning signs that should never be ignored. A value that worsens at every check, several altered values at the same time, symptoms present even when numbers are not extreme, changes after starting or increasing medication. This is not about panic, it is about consulting early and adjusting what is needed. Keep your test results and compare them with previous ones. Ask for clear explanations. Do not stop or modify medication on your own. And do not normalize worsening values just because they are still within range. The range is statistical, not personalized. Your history matters. Understanding a blood test is not obsessing over numbers. It is listening to your body before it starts to shout. Prevention does not begin with disease. It begins with information and awareness. Now tell me honestly, how long has it been since you last looked at your blood test carefully? If you made it this far, write in the comments, "I take care of my health," because yes, health always comes first.